Hi, my name's Alyssa.
I'm Dakota.
And I'm Gwen Lemley.
We wanted to do a presentation on a problem that we felt like was very prevalent in the United States. The first thing that came to mind was childhood obesity. It's an ongoing epidemic in this country. 34.2% of 6 to 11-year-old children are overweight or obese and fall into that obese category. This causes a lot of comorbidities whenever children become adults, such as type 2 diabetes, hypertension, non-alcoholic fatty liver disease, and others. So it's really important that we tackle this head on before they become adults, so they don't have to worry about these comorbidities. So the intervention that we decided to focus on is physical activity, because it's so common for children nowadays to only want to sit around and watch television and use technology and sit in front of a screen. So our PICO question is basically obese school-age children in the United States. How can we decrease their weight or BMI with daily physical activity versus when they have that sedentary lifestyle using technology, and how does that create weight loss in the end?
All right, and to help guide our research, we used Dorothea Orem's self-care deficit theory, which we've become very familiar with this semester. Her theory focused on the patient's self-care capacities in the process of designing nursing actions to meet the patient's self-care needs. So it pretty much says the nurse is kind of there to help the patient get back to their full capacity before their debility to where they can care for themselves. And this is really relevant in children because they kind of can't care for themselves since they're younger. So we felt that this was really relevant to this research. As far as results, Gang Zhang and colleagues, they conducted a study to see if there was a relationship between television watching and childhood obesity. And they did find a linear dose response relationship for TV watching and childhood obesity with a p-value of less than 0.001. So it was very much so statistically significant. And the risk of obesity increased by 13% for each 1 hour a day of TV watching.
Also, Bull conducted a study to look at the effectiveness of exercise as a treatment for childhood obesity. They found that adding exercise as well as a well-balanced diet improved weight loss and helped them to maintain non-fat body mass. It displayed the correlation between exercise and weight reduction in children. And just kind of showed how that exercise is beneficial to kids who are sedentary. Nemeth and colleagues conducted a quantitative analysis to show the short-term and long-term effects of different interventions, physical activity being one of them, for the treatment of obesity in children. They found that after just 3 months of diet and physical activity changes, there were significant differences in body weight, body fat percentage, and cholesterol level, LDL cholesterol level, and their overall fitness. It was relevant to our study because it proved that the intended intervention has significant results in decreasing the effects of childhood obesity.
And then Nig and colleagues conducted a review of the literature, and the results showed that a combination of involvement between children, parents, teachers, and community members in interventions such as activity, decreasing TV, was significant in that it targeted increasing physical activity, decreasing watching TV, eating healthy food, and this decreased the obesity in home and community settings. Then Fang and colleagues conducted a meta-analysis to determine if obesity was positively correlated with total screen viewing time. They found that screen time greater than 2 hours a day was positively associated with childhood obesity, and increased screen time and increased sedentary behavior can be a risk factor for being overweight, obese in children and adults or adolescents.
All right, and for practice implications, one big role of a nurse is to advocate for their patient. And this is really important in the pediatric population because they're so young and they don't know how to care for themselves. So it is super important for a nurse to advocate for their patient. Nurses can utilize the information found in this study to help advocate for their patients and teach both children and parents, since they are their primary caregiver, about the importance of exercise to combat childhood obesity. And according to the Center for Disease Control and Prevention, preventing obesity in childhood will reduce the risk of developing the serious health conditions like Alyssa touched on earlier, like diabetes, heart disease, and cancer. And ongoing education that is evidence-based is essential in nursing practice.
And at our conclusion, the main finding of this review of the literature was that physical activity shows significant positive outcomes in children who are obese, and that technology plays a significant role in the decline of physical activity in children. And it's positively associated with childhood obesity versus with less than 2 hours of TV compared to greater than 2 hours of TV, increasing BMI in children.
Thank you for listening to our research project that we conducted on childhood obesity, battling a national epidemic in a modernized world.